Arthritis Broadcast Network viewers. I'm Cheryl Cohen. I am the founder and president of Arthritis Consumer Experts, and we host the Arthritis Broadcast Network booth. And I'm so happy, as a person who lives with inflammatory arthritis, rheumatoid arthritis to be exact, I'm absolutely over the moon to be in the studio here today with two arthritis health professionals that are near and dear to all of us who live with some form of inflammatory arthritis. I'm pleasure to meet and see Karen Sui again, who's a physiotherapist with Fraser Health, and Sarah Bryant, who's an occupational therapist at Fraser Health. And they're in studio with us today to talk about a really, really important new program that's been developed and launched. I think you're at about 6 months now, right?
Yes.
Yeah, 6-month birthday. This is the celebration. That focuses on delivering really important services and education to people living with a variety of forms of inflammatory arthritis. So what's the name of the program? When did it start and why?
Okay.
And where? We'll throw in the where too.
Yeah, well, it's called the Surrey Inflammatory Arthritis Clinic. It's based out of Surrey Memorial Hospital.
Yep.
And it was created because there's a need, obviously, for people who are newly diagnosed to receive multidisciplinary services and support from occupational therapists and physiotherapists to help manage your disease right from the start of diagnosis.
Yeah, great. The region where it's located. Why Surrey? What's the scope? Like, who can come through the doors?
So we see, at the present time, we're seeing people who are age 18 or over, who have rheumatologist diagnosed rheumatoid arthritis that has been diagnosed within the past year or two. So if you would like a referral to the program, make sure you ask your rheumatologist. So all the rheumatologists in BC have our referral forms.
Okay.
Yes.
Great. So if you're a rheumatologist, you're in the Fraser Health region, your rheumatologist needs to write a letter to one of you nice people, and you're going to say, come on in and let us help. Tell us about the program offerings, and who, if I come in, do I see both of you? Who do I see and when? Does it cost anything? Just some really fundamental questions I think we want to get answered right up front.
Right. So the program is publicly funded, meaning that it's free to the consumer. And when you come in, the first thing you would be asked to do would be to attend one of the education sessions.
Right.
Because we find that's really helpful.
Yeah.
And also you can meet other people who are in a similar situation to yourself in the education session. Then after that, we would book a one-to-one session. And that could be with either myself or Karen. So we work in a transdisciplinary model, which means that we've both trained each other in the basics of our profession in rheumatology. And then if you had something really specific to the discipline, you could see either of us as needed.
Both of us have received extensive training in the management of all types of arthritis.
Yep.
And we have multiple years of experience treating people with arthritis.
You guys can swap out for each other, which is a real time saver and energy saver for patients. Depression and anxiety, as you know, is really is quite a significant burden on people with inflammatory arthritis. Do you offer sort of assistance in that way, or is it more of a directional thing where you're sending them then to the right person who has that expertise?
I think sometimes it's just approaching the subject and letting people know that that's common and that there are resources out there that can help people. And so what we would usually do is direct them to the resources that are available. So different self-management programs like Bounce Back, the name of a program that your GP can refer you to help you with mild to moderate depression. And it actually offers telephone counselling, as well as there's a sort of online course that you can follow to help with managing.
consultation session lasts approximately 2 hours.
Yep.
And what we usually cover in it is what is rheumatoid arthritis, so that you understand what the disease is, what to expect with having it, how it normally would progress, and both how it's treated pharmacologically and non-pharmacologically.
So that's with meds and without meds?
Yes.
Okay.
So there are many things that you can do in addition to the medications to help manage your symptoms. And at the end, there's some time to hear other people's stories if people are willing to share. And we've had really positive feedback actually about the
the brother or sisterhood that forms, I think, is a really important outcome.
Mm-hmm.
What is today's occupational therapy for someone living with rheumatoid arthritis?
I think the first thing that we do is try to find out from the person what are the functional problems that they're having. So I might ask you, what are the things that you are finding a bit more difficult to do?
So give me an example of that.
So that someone might say, or they might say, I'm having trouble to lift up the kettle, or I'm having trouble to open a jar, or they might say something a little more along the lines of, I can't walk as far as I used to.
Okay.
So, and it would depend on what that person tells me is the problem as to what we then would do about it, because we found that if we just provide all the information, it's overwhelming. So focusing in on the person's specific needs that they want to change, then helps them to apply. Say this example of opening a jar, I'm just going to take that one. Then we would look at why that is. So from an occupational therapy point of view, we would look at adaptive equipment. So that might mean using equipment that can help increase your leverage, so that it's easier, non-slip to take away the sort of to add more friction, things with bigger handles to reduce the stress when you're gripping really hard. So we might look at that type of thing, but also because we both are working together, I would also look at, is it a strength issue, is it a range issue,
which would be something that in the past would have fallen only into the auspices of a physical therapist. But Karen, for you, physical therapy today in 2018, what does it look like?
For people with arthritis, often I get people coming into me saying, I don't know what I can do, I don't know what's safe, I'm scared of making my joints worse or causing more damage. And so a lot of it is providing education and reassuring people that, hey, it's better to move than not by far. And providing ideas about what they can start with.
There's a rich body of research evidence that shows exercise is a really good thing, but you hit it on the head, Karen, that is people don't know what to do. They don't know what a safe limit is. So do you go over things like that then when you're in the clinic, in the program?
Yep, absolutely. And again, it's individualized. So as Sarah mentioned, sometimes people will say certain parts of their body are bothering them more than others, certain joints, and I do usually do a full assessment of that joint, and that helps guide me as to what that person may need, whether it be strengthening exercises or just general water exercises, range of motion, stretching,
splinting, I guess, or supportive. So this is a program that's explicitly for inflammatory arthritis, cross-disciplinary, free, and provided across a geographic range that doesn't encompass the entire province. There are other regions currently offering something similar, but it goes by a different name.
Absolutely, there are. This is actually a regional inflammatory arthritis rehab program, so we do have other sites. But with the Surrey site, what we've started is a satellite clinic out in Abbotsford every second Friday of the month.
Great.
In addition to that, if you have other types of inflammatory arthritis, there is also the Burnaby Hospital Arthritis Program that you can ask for.
So their scope is beyond rheumatoid arthritis then?
Yeah,
so it would include psoriatic and ankylosing spondylitis?
Yes.
Can they access you by phone? Like, let's say I had a conversation with you, Sarah, and I went away, I was overwhelmed, and I didn't feel maybe like I retained everything I heard from you. How do I ask questions of you? Do I have to book another appointment? Can I call you? How does that work?
You can absolutely call, and sometimes we will schedule a follow-up as a telephone visit as well, because for some people, which is why there is a Fraser Health program as well, is to improve accessibility. For some people, the travel is quite a barrier for them.
Yeah.
And so being able to access us by phone can be helpful. And even today I had somebody who was working on goals around becoming more active, and so we set up a phone call for today, and we just sort of reviewed. It's something I don't actually need her in the office to do, but it works almost like a coaching kind of system to keep her going towards reaching a goal.
That's amazing. Congratulations, because again, that's sort of a more modern approach to delivering certain types of healthcare. Have you tried to accommodate, people who work and have schedules that might not be the 9 to 5 schedule?
Yeah, exactly. We incorporated that into the hours designed into the clinic.
Yeah.
So we do have some evening and weekend hours that are available.
Okay.
For appointments with us.
Okay, and someone would just simply need to ask if an appointment like that was available.
Yeah,
okay,
exactly.
Fantastic. So Monday to Friday, typical hours, but also evening and Saturdays.
Yes.
We thank you for tuning in, for watching this video, and we hope you found the information provided in it of use to you. And certainly if you are a patient with rheumatoid arthritis over 18, recently diagnosed, and living in the Fraser Health region, we hope you reach out to this fantastic program and talk to Karen and Sarah and let them help you.